Let's go back to Port-au-Prince right now. Dr. Robert Fuller is joining us from the International Medical Corps. What's the biggest problem, doctor, that you face right now?
Well, we still have far too many patients that are far too ill for the facility that we're operating out of at the General Hospital here.
Do you have the medical equipment, the surgical equipment, the anesthesia, the stuff that you need to save lives?
Well, things are coming together. It's certainly not the way it is back home, but we're slowly getting more and more pieces. We right now have 7 operating rooms up and running on the campus. We really could use 20 probably. At times we run so low on medications it gets difficult to know whether we're going to be able to continue to operate, and then we'll scrounge some more. We're starting to see the beginning of the pipeline of the aid that's flowing into the country start to arrive at our campus finally. And we're hopeful that as that aid starts to come in and we can organize it and use it to its fullest, we'll get more effective at getting patients seen and cared for.
What's so frustrating, not only to me, but to all of our viewers, so many people, Dr. Fuller, is that someone is saved from the rubble after several days, now a week, but they die because there isn't the proper intensive care medical attention that they require. I'm sure you've seen that up close over these past several days, have you?
Oh, absolutely. We have many patients die every day. We don't have any intensive care, as you mentioned, at our facility, and I don't expect we will for some time. But it's just the line is so long to get, you only have so many operating rooms, and these patients need to have surgeries in order to save their lives, and so somebody has to wait, and people are dying in the process. It is a really tough time.
Is that going to happen? Those kinds of intensive care units, the sophisticated hospitals that we take for granted, can it be possible to do that on a temporary field basis model?
Oh, I think that will happen. I think that with all the aid flowing in probably a handful of days, our hospital will have intensive care capability, and other hospitals might as well. This is the referral hospital. It's really the biggest hospital in Port-au-Prince, and it's a place where the sickest people always were sent, and I expect we will have ICU care, but way before we need ICU care, we need to be able to operate on all these people that have crushed extremities that need to be amputated to save their lives.
How many doctors and nurses are with you from the International Medical Corps? And tell our viewers what the International Medical Corps is.
Well, the International Medical Corps is a volunteer group that runs out of the United States. They operate throughout the world. Their principal mission is to respond to disasters and then to help the communities develop infrastructure for health care, including education and health care resources like midwives or what have you, all around the world. My mission as an emergency doc on their team is to get in and we have 18 clinicians, mostly doctors and some nurses, all emergency personnel. And we're in charge of triaging new patients, doing treatment in the field, preparing them for the operating room, and caring for them after they leave the operating room.
Where are you from, Doc?
I'm from the University of Connecticut in Farmington, Connecticut.
Well, good luck, and thank all the men and women who are working with you, saving lives. Appreciate it very much. Dr. Robert Fuller with the International Medical Corps. He's doing important work saving lives. Appreciate it very much.